Oh, that's a body surface area. That's incredibly dangerous. Not only is the person going to be in a tremendous amount of discomfort, pain is interesting because if you have third-degree burns, it really sears off the nerve endings. Therefore, you don't feel pain. Now, I've had patients who've had third-degree burns. They tell me it absolutely does hurt. I guess it really depends on the situation. Then you also have to really carefully manage electrolytes because when you have that much skin damage, you have electrolyte abnormalities. You can dehydrate quite quickly because skin actually acts in a way where it prevents water loss. Very dangerous situation. Very, very dangerous. Those nerve endings are most likely charred. And you know, when people say first, second, third degree burns, what they're really talking about is how far the burn goes deep. So a first degree burn is just a superficial epidermis layer of the skin. Second degree is considered a partial thickness burn, where it's epidermis and partially of the dermis. Third degree is a full thickness burn, epidermis, dermis, potentially muscle, fat, bone, tendon underneath, all of that. And in a situation like that, you have to make sure that there is no septal hematoma. If there is a hematoma, which is just a collection of blood in the area where the septum is, you need to drain that quite quickly. That's an urgent intervention because if you don't, it can actually lead to necrosis from putting pressure on the area where there's not great circulation to begin with. And as a result, you can develop a saddle nose deformity. Here's an image of that. And you obviously don't want that to happen in order to have healthy breathing. So a lot of times for a nose fracture, you don't need to do surgery. Again, if there's a septal hematoma, you might need to drain it. But a lot of times you can do a closed reduction.
Tender denasal CT head maxillofacial.
I'll give them a heads up.
If you do an x-ray of the area, you get a two-dimensional view, and sometimes it's really hard to actually rule out if there's a fracture happening. That's why you need a CT scan of the area. Normally, I don't like ordering CT scans of the head, but in a situation like this, when she took a fall, maybe got knocked out, that is a mechanism of injury that is compatible with getting a CT scan. A stroke means that someone's either having an ischemic or a hemorrhagic stroke. Those are the two types of strokes. Ischemic being that there's a blockage in the blood vessels that supply oxygenation and blood flow to the brain. If you have a hemorrhagic stroke, that means a blood vessel has ruptured and then there's bleeding into the brain. Both are actually the same problem in the sense that they're not receiving oxygen. One is a problem of a blockage not receiving oxygen and blood flow. The other one is because there's bleeding, therefore you're not getting oxygen and blood flow. And the most important thing when you're finding a patient who has a stroke is time. You want to act as quickly as possible.
Jane Doe, looks like she's in her 20s. Obvious aphasia, right-sided hemiparesis, and facial droop.
All right, so what they're describing here are important factors to think about when there's a stroke. We have an acronym. The stroke organizations use FAST as an acronym. I like BFAST. And each letter has a different meaning for it. B for balance, I for eyesight, face for facial asymmetries, A for arm weakness, S for speech abnormalities or difficulties, and T, the most important, time. The reason time is so important is that you want to minimize the amount of time that the brain suffers hypoxia. Because what happens is if you have a very long time where the brain is hypoxic or a region of the brain is hypoxic, not receiving oxygen, damage can happen, so much so that even if you open that area after the fact, the damage can be permanent or even become worse, where an initial infarct in the brain starts actually spreading. It's called the penumbra.
Who gets a stroke in their 20s?
I would say one of the most common causes of a stroke in someone in their 20s, outside of having an aneurysm that ruptured, which actually happened to the actress on Game of Thrones, is if you have a hole between your two atria that has not closed, and as a result, a blood clot that potentially can, let's say, happen in the legs from sitting for too long, actually makes its way up the venous system. And then because there is that hole, ends its way up into the left side of the heart and then gets shot out to the circulation, potentially the brain, causing a stroke. There's two ways that you can go about dealing with a clot. You could either have the endovascular team pull the clot out, go in and pull it out. And another way is to use a clot buster to actually break up the clot. I don't know the exact distinctions that need to be made of who's high risk, who would benefit from each operation. I'm sure there's a whole criteria that ER physicians use, but I'm surprised that they're not deciding that based on some criteria as opposed to just arguing. A lot of times when a baseball hits the orbit there, you get what's known as a blowout fracture in this thin area on the inside of the orbital area. That is quite painful, lots of bruising. You could also have a ridge fracture a little higher up, but this bone is a lot stronger. Obviously, the floor can also be damaged, the orbital floor, but there you'll start seeing neurologic signs, muscular issues where the eye can't move into a certain direction. Obviously, you want a CT scan urgently here. That means he's not able to take a full deep breath. I just don't know why the med student is running in to make this diagnosis, right? He's a fourth year med. I always have this issue. He's a fourth year med student. Why is he making decisions?
Wait, what's that? What's going on?
Ventilator is having trouble pumping air into Teddy's lungs.
Sometimes that can happen as a result of pulmonary fibrosis. It could happen. Oh, also, he has this massive burn. As a result, it could cause that compartment syndrome-esque situation where it's actually acting like a binder around his rib cage and not allowing